Imagine waking up at 3 a.m. in the morning and discovering your partner of 11 years passed out cold on the floor. Imagine taking this partner, this same sex partner, to the hospital seeking medical attention from supposedly culturally sensitive, culturally trained healthcare professionals. But once you disclose to these healthcare professionals your same sex partnership, you feel the temperature in the room literally drop below zero. You then begin to receive cold shoulders from these same healthcare professionals, supposedly culturally sensitive, culturally trained in culturally healthcare professionals. You see these healthcare professionals roll their eyes, you see some of them laughing, you see some of them shaking their heads, but it makes you feel very small. But you still stay there so that you can get assistance for your partner. Okay, 2, 3 hours later, the doctor comes in and hits you with a ton of bricks. He discloses to you and your same sex partner that your partner that you thought was healthy as a horse exercised on a regular basis, ate healthy foods, but he is in what we call end stage renal disease. Yes, kidney failure, and must begin receiving hemodialysis immediately. That means having a permacath surgically placed in your chest and you going on to or being hooked up to a machine anywhere from 3 to 4 hours daily. And if you refuse this treatment, you can die. Okay. Uh 3 years later, you're back at this hospital, same emergency room, same untrained, and you discover that they're untrained culturally. Cultural sensitivity does not exist. These same unprofessional healthcare professionals treating you in the same manner, but yet and still you're there for your partner. And guess what? Your partner's there because he had a stroke. And not only did he have a stroke, but this stroke left him physically impaired, totally dependent on you. But guess what? You have no support because you decided to love who you wanted to love, be who you wanted to be, and live your life for you and only you. As a result of that, your family decided to disconnect themselves from you. So, guess who's going to have to be the caregiver, the informal caregiver for this partner? Yes, you're correct. You will have to serve as the informal caregiver. So, that means your life as you knew it no longer exists. That means that if you're working a full-time job, yes, you may have to scale back on the hours that you work. For example, if you're working 40 hours a week, you may have to work 20. It's also in the literature. The literature states that that's one of the drawbacks or one of the issues that most informal caregivers they have to do that. That's a decision they have to make. They have to come back on their hours. Your social life is no longer yours anymore because it may be full with doctor's appointments. And if you're experiencing transportation issues, that's one of the issues that I've witnessed as a dialysis social worker. I've witnessed caregivers experience transportation related issues. Guess who has to transport the patient to and from dialysis into outside medical appointments? Yes, you, the informal caregiver. And if you are a same-sex, if you're involved in a same-sex relationship and you have no family support, you have to do that. Um, and also, as an informal caregiver for a dialysis patient, that will require you to cook his or her meals. Because guess what? That dialysis patient can't just go and pick up. You can't go by a fast food restaurant and pick his or her, or him or her, of any types of fast food meals. Because guess what? They're on what's called a renal-friendly diet. Yes, high protein, low sodium, low fluids, or sometimes, yeah, low fluid diet. So that means you have to cook. Not only that, but going back to what I was stating about your quality of life, your quality of life issue, you may experience quality of life issues as well as sleeping pattern issues. Also, as an informal caregiver, as a matter of fact, there was a study completed by Salick and others in 2012, and in this study, they compared the quality of life and sleeping patterns between dialysis patients and their caregivers. The results indicated that 73% of the dialysis patients, hemodialysis patients, were experiencing um, sleeping pattern issues and quality of life issues, whereas 88% of the caregivers were experiencing quality of life issues and sleep pattern issues. I know some of you guys might say, going back to what I was stating about, what about FMLA? Family Medical Leave Act 1993? Yeah, what about it? No offense against to FMLA. I think it's a great act. I think it's a great law. But at the same token, if you read it and you understood it, it would one would think that it's designed solely for heterosexual couples and for individuals who have to take time off of work to on long term um, time off of work to take care of blood relatives. So guess what? That leaves little room for same-sex couples. There's also the National Caregiver Family Act that's in place, but that's designed to assist individuals, caregivers who are taking care of individuals who are 60 plus. Okay, that's good. And again, no disrespect, I am happy that that act is in place. But what about individuals, same sex couples, who have partners who are under 60 years of age? What type of help for them? And as a dialysis social worker, I have to sometimes ask myself, what interventions to utilize when you see caregivers who wholeheartedly love their loved ones, but at the same token, you see them burning out. You see them about to crash and burn. You see the poor quality of life that they had. You see their social relationships that they had with other co-workers and friends being transformed into something that consists of coming to the dialysis clinics and going to medical appointments. Their life is not their life anymore. And as a result of that, some of them feel a lot of mental health distress. As a matter of fact, there was a study completed with this emerging intervention by Chowix in 2011. The N was very large. There were 130 caregivers included in this study. And they had a comparison group, and they also had an experimental group. The comparison group were individuals that received just regular telehealth services, whereas but telehealth services. But the experimental group were for the individuals, the participants, research participants, caregivers that received the telehealth, um, telephone counseling services. And the results indicated that the individuals in the experimental group, their mental health distress declined. Um, Also, there was a study completed on by Elliott and others in 2009. And in this particular study, they actually utilized PST, also known as problem solving theory slash therapy, and they utilized it in combination with telecounseling. And the N was very large. There were a total of 81 caregivers and a total of 81 patients. And the results indicated that telecounseling and problem solving therapy together made a great combination. It was a great combination therapy. But although it is an emerging intervention, there are some ethical issues that I have a problem with. One of them has to deal with the state social worker laws that we are governed by as social workers that we are expected to adhere to. What happens if I have someone call me from the state of Georgia and I'm practicing social work in Mississippi, and this particular caregiver is asking for my services, but guess what? I'm not licensed to practice social work in Georgia. I'm licensed to practice social work in Mississippi. What do I do? Do I just give this caregiver a referral and send them on? Or do I provide them with services and be that great super social worker? What do I do? Also, one of the other issues that I have with this emerging intervention is that it's written in the literature that Medicare will not pay for certain services that are rendered if it's not considered face to face. So, one has to ask themselves, is telephone counseling considered face to face? So, therefore, as healthcare professionals, I think we have a lot of work to do. One of the things that we have to do is to begin to tackle research topics such as, or continue to tackle them, or begin tackling them, these emerging interventions. Um, Continue to do large, large, larger size sample studies, experimental studies with these particular interventions. And another thing that we have to do is begin to lobby for same-sex couples to be provided with the same laws and policies in place for heterosexual couples. So that concludes my TED Talk. Thank you.